Hey there, have you ever felt like your mood swings are so intense they could represent the seasons of your life? One minute you're on top of the world, and the next, you feel like you're sinking. If that sounds familiar, you're not alone, and this video might just shed some light on what you or someone you love could be experiencing. Today, we're diving deep into something that's often misunderstood: bipolar disorder. And trust me, it's way more than just mood swings. Bipolar disorder, once called manic depressive illness, is a mental health condition that causes intense shifts in mood, energy, and activity levels. It can make even the simplest day-to-day tasks feel impossible. And we're not just talking about feeling up or down. This is extreme. From feeling like you're invincible one moment to crashing down into hopelessness the next. There are three main types of bipolar disorder: bipolar I, bipolar II, and cyclothymic disorder. Each of these has a unique set of mood changes. Bipolar I is defined by manic episodes that can last for at least 7 days, or symptoms that are so severe you might need medical care. And usually, depressive episodes follow, lasting at least 2 weeks. Then there's bipolar II, which involves a pattern of depressive episodes and hypomanic episodes. The difference? Hypomania is less intense than full-blown mania but still disrupts daily life. And finally, cyclothymic disorder. This involves recurring hypomanic and depressive symptoms, but they're not severe enough to qualify as full manic or depressive episodes. But let's dig a little deeper, because bipolar disorder isn't just about mood. It's actually rooted in the chemistry of the brain. Neurotransmitters like serotonin, dopamine, and norepinephrine are often out of balance in people with bipolar disorder. And this imbalance doesn't just mess with your emotions. It affects sleep, focus, and even how you experience pleasure or pain. Think of it as a ripple effect. When these chemicals are off, everything from your sleep patterns to your ability to concentrate gets thrown out of whack. And here's where it gets tricky. Bipolar disorder isn't just a "you had a bad day" situation. These mood shifts can last for days, weeks, or even months. Imagine being stuck in a manic phase where you feel on top of the world, then crashing down into a depressive phase where getting out of bed feels impossible. But bipolar disorder isn't the same for everyone. That's why it's so important to understand the specific type of bipolar disorder someone has. It also explains why treatment needs to be personalized. There's no one-size-fits-all solution here. Now, let's talk treatment. Managing bipolar disorder often starts with medication, like mood stabilizers or antipsychotics. These help keep the extreme highs and lows in check. But medication is just one piece of the puzzle. Cognitive behavioral therapy, or CBT, is a type of talk therapy that has shown great results in helping people manage their thoughts and emotions. And it doesn't stop there. Lifestyle changes, like getting your sleep patterns regulated, staying active, and practicing stress management techniques, can make a huge difference. We're talking about routines, exercise, and mindfulness. These things help balance out the extreme mood shifts that come with bipolar disorder. Scene transition. Speaker walking with a backdrop of various mental health professionals. Speaker. Getting the right diagnosis is crucial. Often, people are diagnosed in their late teens or early adulthood, but it can happen earlier, even in childhood. A mental health provider will look at your symptoms, your personal history, and sometimes your family history, to make the most accurate diagnosis. And here's something important. Many people with bipolar disorder also have other conditions like anxiety, ADHD, or even substance use issues. Some may experience psychosis during extreme manic or depressive episodes, like hallucinations or delusions, where their perception of reality gets blurred. That's why getting the right diagnosis is so important. Scene transition. Speaker sitting down, showing graphics of brain scans and genetics. Speaker. Let's also talk about risk factors. Researchers believe that genetics play a role in developing bipolar disorder. If you have a parent or sibling with bipolar disorder, your chances of having it are higher. But it's not just about genes. Brain structure and environmental factors like stress or trauma also contribute. Scene transition. Speaker looking hopeful. Upbeat music begins. Speaker. Now, here's the good news. Treatment works. Yes, bipolar disorder is a lifelong condition, but with the right combination of medication, therapy, and lifestyle changes, people can live fulfilling, stable lives. And the more we understand about this condition, the more we can break the stigma that surrounds it. So, next time you hear someone casually say, bipolar, to describe something like the weather, remember this. Bipolar disorder is a serious condition. It's not about being moody or unpredictable, it's about managing a complex mental health condition. So, let's do our part to bring more compassion and understanding into conversations about mental health. If you or someone you know is living with bipolar disorder, reach out to a healthcare provider. And remember, help is always available. Thanks for tuning in. If you found this video helpful, don't forget to hit the like button and subscribe. We've got more in-depth content coming your way. Take care, and we'll see you in the next one.